Hi everyone, welcome back to my YouTube channel and today we are going to talk about lacrimal apparatus. So let's start our topic with introduction. Lacrimal apparatus is a system of structure that is responsible for tear production, distribution and drainage. It keeps the surface of eye moist, provides nutrients to the cornea and helps remove debris. It consists of lacrimal gland that is for tear secretion, lacrimal duct that are transport tears to the eye surface, lacrimal canaliculi, lacrimal sac, and nasolacrimal duct that is to drain tear to nasal cavity. Lacrimal gland is the first part of lacrimal apparatus. It is serous gland and it is tubulo-alveolar gland in structure. It is divided into orbital part and palpebral part. Orbital part of it is larger and present superiorly, and palpebral part is smaller and present inferiorly. It is situated in the lacrimal fossa of frontal bone, superior lateral to the eyeball. It produces aqueous layer of tear that lubricate and protect the eye. Second is lacrimal ducts. That is the second part of lacrimal apparatus. There are small ducts that are about 10 to 12 ducts that emerge from lacrimal gland. They open into superior conjunctival fornix where tears are secreted onto the eye surface. Tear distribution on eye. Tears spread across the cornea and conjunctiva during blinking and that is aided by eyelid movement. They accumulate at lacrimal lake near the medial canthus then. Then there is third part of lacrimal apparatus that is lacrimal puncta and canaliculi. Lacrimal puncta is small opening on the medial margin of upper and lower eyelid. They are located on the lacrimal papillae. They serve as an entry point for tear drainage. Second is lacrimal canaliculi. They are two canaliculi, upper and lower, that drains tear from the puncta. Each canaliculus has vertical part and horizontal part, then both usually join to form a common canaliculus that open into the lacrimal sac. Next part is lacrimal sac, that is a membranous sac located in the lacrimal fossa between the anterior and posterior lacrimal crest. It acts as a reservoir for tear before they pass into the nasolacrimal duct. Next part of lacrimal apparatus is nasolacrimal duct. It is last part of the lacrimal apparatus and it is the continuation of lacrimal sac as you can see in the diagram. It opens into inferior meatus of nasal cavity that allows drainage of tears into the nose. It explains why crying causes a runny nose. Nerve supply of lacrimal apparatus. It has parasympathetic nerve supply, sympathetic nerve supply and sensory nerve supply. Parasympathetic nerve supply of lacrimal apparatus is from facial nerve, that is 7th cranial nerve, through the greater petrosal nerve and pterygopalatine ganglion, and it stimulates tear secretion. Second is sympathetic nerve supply, that is from superior cervical ganglion and it regulates blood supply. Third is sensory nerve supply, that is from the ophthalmic nerve, that is branch of trigeminal nerve, and it is through the lacrimal nerve. Blood supply of lacrimal apparatus. It is by lacrimal artery, that is branch of ophthalmic artery, and venous drainage is by ophthalmic veins. Clinical significance of lacrimal apparatus. First is dacryocystitis, that is inflammation of lacrimal sac and it is often due to nasolacrimal duct obstruction. Second is dry eye, that is also called as keratoconjunctivitis sicca, and it is caused by lacrimal gland dysfunction or autoimmune disease that is called as Sjogren syndrome. Third is congenital nasolacrimal duct obstruction and it is common in infants and it leads to epiphora, that is tear overflow. Fourth significance is trauma as injury to canaliculi or lacrimal sac may impair tear drainage. Summary: lacrimal apparatus is a functional system for tear production and drainage. Lacrimal glands secrete tear, then tears spread across the eye and drain through the lacrimal puncta and canaliculi into the lacrimal sac. Tear pass through the nasolacrimal duct to the inferior nasal meatus then, and this system maintains ocular health, lubrication and protection. And this was all about lacrimal apparatus. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.